Hearing loss is among the most common and untreated disabilities in the world, but a new study is highlighting just how unaware many Americans are about the need for screening and the availability of treatments. Our Dr. Frank McGeorge here with a closer look. Hey, Doc.
Hey, Jason. Yeah, this is a huge issue for so many people. 1 in 8 adults in the U.S. suffers from hearing loss, and that includes more than 2/3 of people over the age of 80. But far too many are just trying to live with it. A new survey from the Cleveland Clinic finds among adults between the ages of 50 and 80, only 9% are able to properly identify what's considered a normal range of hearing.
Unfortunately, the results of the survey were really not that surprising. They're important for people to understand, but the fact that they were so underwhelming is pretty much what we expected. We know that patients don't understand hearing loss and how important hearing really is for our overall health.
Dr. Sarah Sidlowski is the audiology director for the hearing implant program at the Cleveland Clinic and the president of the American Academy of Audiology. She says the survey also found people are putting off getting their hearing checked. For example, 72% said they were very likely to get an annual physical, 66% were very likely to get an eye exam, and 59% said they would very likely take their pet to the vet. But only 27% were likely to get their hearing checked. When hearing loss is left untreated, it can lead to depression, social isolation, safety concerns, and poor quality of life.
You would never go to a primary care provider and have them say, you have high blood pressure. That's common in older age, so just learn to live with it. They would recommend medication. They'd recommend diet and exercise. They'd make sure that you're monitored and you come back and they're keeping an eye on it. And so we really need to do the same with hearing loss as well.
So why are people not taking hearing loss as seriously as other health issues? Well, Dr. Sidlowski says some people think of hearing loss as just a typical part of aging that they have to accept. Others, frankly, worry that they're going to look older by having to wear hearing aids, and some may just have primary care physicians who don't realize how much can be done to improve hearing loss.
Yeah, and they often don't realize how small they are. A lot of people don't even know anymore that people have them on. And Frank, I know the FDA recently gave the green light to selling hearing aids over the counter starting in October. What effect do you think that'll have?
Well, experts think that change is going to make it easier for people to give hearing aids a try by making them more accessible and less expensive. But that's really only for people with mild to moderate hearing loss. And there really is a benefit to getting tested and having a hearing aid professionally adjusted specifically for you. So that's something else to consider.
Yeah, very true. All right, Doc, we appreciate it as always.